This is Laurel Mildred from the California Collaborative for Long-Term Services and Supports. Joining me today is Lydia Missaelides, Executive Director of the California Association for Adult Day Programs and a member of the Collaborative. Lydia is here to describe adult day programs and how they contribute to a high-performing system of long-term services and supports.
Thank you, Laurel. Adult day services come in two basic models. The medical model called Adult Day Healthcare, ADHC, or in the Medi-Cal system, it is known as Community-Based Adult Services, or CBAS. The non-medical or social model is called Adult Day Program. Adult Day Healthcare is licensed by the State Department of Public Health and overseen by the California Department of Aging and the Department of Healthcare Services. Adult Day programs are licensed by the Department of Social Services Community Care. Lists of centers are located on the department's websites and our own website, www.cads.org. Adult Day Services programs are licensed daytime places that offer supportive peer interaction, therapeutic activities, and health services delivered by a team of skilled professionals and trained aides. The care is person-centered, which means that services are customized to meet the needs, interests, and preferences of persons served, who can be anyone over the age of 18. People attending the centers usually have multiple health conditions that are ongoing, such as Alzheimer's disease or other dementia, diabetes, high blood pressure, mental health diagnoses such as depression or traumatic brain injury. Some have had a stroke or have breathing problems or have trouble taking medications properly, just to give you some examples. Adult Day Healthcare programs are a Medi-Cal benefit under managed care, and adult day programs are mostly paid for by the person attending or their family. However, both models are based on a philosophy of supporting a person's independence and choice to live in their community. The center staff is expert in supporting older adults with chronic conditions who have difficulty managing their own care because they require complicated medicines or treatment, lack a support system, live alone, or perhaps in an unhealthy living situation. Sometimes they even have hidden substance abuse or are victims of neglect or abuse. Services range from skilled nursing, social work, and physical therapy provided in the ADHC to close supervision, help with activities of living, and brain-stimulating structured activities in the Adult Day Program model. Transportation is always either provided or arranged. An added value is caregiver support, knowing the loved one's needs are being met during the day. Research tells us that caregiver stress is a leading cause of placement in a nursing facility and also puts the cared-for adult at risk for elder abuse or neglect. It also tells us that caregiver stress is reduced when adult day services are used regularly. Adult day services are the only settings that both support and serve the care recipient and their caregiver or family in their community neighborhood. After 30 years, adult day services are no longer a best-kept secret because as our population ages, people realize they want to live in their home community for as long as possible, and adult day services are a valued solution.
Thanks for sharing this information, Lydia. If you'd like to learn more about other issues that impact long-term services and supports, if you'd like to hear more podcasts of this nature, or if you have any comments or questions, please visit www.ccltss.org or call 916-966-6643.